my name is Carrie Holder. I'm an EMTP. I work for Star EMS, and I've been a paramedic for 11 years. My entire career has been with Star EMS. I became a paramedic because my sister started having babies, and I was watching my nieces and nephews. And I was nervous because if something were to happen, like if they were choking or if they were bleeding, I didn't know what to do. So I took a basic EMT class and loved it, and went on to become a paramedic. One particular call that stands out in mind is we went on a call for somebody having chest pain, and when we got to the scene, there was a mid-50-year-old woman there. She was extremely diaphoretic. She was holding her chest. She was complaining that she was having a 10 out of 10 chest pain, but no prior history of any heart problems. Once we put her on the EKG, I noticed that she was having an inferior MI. I called into Huron Valley and confirmed that she was having a STEMI. The doctor alerted the cath lab. En route, we started an IV. We gave her some nitroglycerin. We also gave her some oxygen and some morphine, and by the time we got her to the hospital, the cath lab was waiting for us there in the ER, and the on-call doctor had confirmed that she did have an ST-elevated MI. After that, the patient went right into cath lab, and she made a full recovery.
Hello, my name is Robert Codney. I'm a critical care paramedic with Community EMS. How I got into being a paramedic is I was actually teaching at Oakland Community College, a medical first responder course. One of my students became a basic and then eventually a paramedic, and I kind of followed the same suit. I actually have a degree in something else, but I went this route. One of the calls that turned out interesting for us was we get a call to a house for a sick gentleman, trouble breathing. And we go there with lights and sirens into one of the local trailer parks. We finally get into the house because nobody's answering our doors. We have fire calling. They finally answer the door and come out, and we find out what's going on. We ask them, how long have you been sick? Have you got fevers? Have you been exposed to any contagious diseases? Everything's coming up no for us. So we get the patient out, bring him out to the back of our truck. We put him on the cot, bring him out to the truck. And after we get him into the back of the truck, he tells us that where he works, he had somebody come in that has traveled overseas and possibly exposed to a contagious disease. So for us, that immediately, since we're already exposed, it puts us, holding the bag. And when we call the hospital here, we got to tell them that, this is what we have. We have a patient that has trouble breathing, been sick for a few days, no real fever, but a possible contagious disease, and we need isolation as soon as we get there. So when we got here, I was driving. I came up to the doors, had him open the door, and I stood outside and I said, "This is what we got. These are our vitals, but we're going to need an isolation room as soon as you can get it for us." And get us a room. We wound up coming into one of the isolation rooms from the outside and being left in there. And then we proceeded to give a more detailed story of what happened for it. And they wound up here calling downtown, talking to the infectious disease doctors, and they deemed it was a non-contagious for us.
Hi, I'm Bill Rabb. I'm a paramedic with Star EMS. I've been in the EMS for 23 years and with Star for 6 years. I was working at GM actually at the time, and they had a jobs bank program. I was laid off, and there was a volunteer agency around the corner. So I went there to do their building maintenance, and the woman there talked me into taking an EMT class. I took an EMT class. I loved it. And everybody, my mentors in that, told me I should go on to paramedic. So the following year I enrolled in paramedic class. The best part of my job is helping other people. When we get a call, it's their emergency, they own it. It's our job to let them know that everything is okay. One of the cases that I'm very proud of. Was my usual partner was absent that day, and we had a new medic, brand new medic. And so we were guiding him, but we had a call for a gentleman out on a dirt road in the suburbs here. And when we got there, the normal routine was I would get the paperwork, the address, and the patient information while he did the assessment. So I was in the hallway when I heard him say, "We need to defibrillate," which is to put an electrical shock to the heart. And I immediately dropped what I was doing and what do we got, and he showed me, and the patient was in VTAC, and it's a rapid heart rate. And so I said, wait a minute, before we do this, let's get an IV, let's give him some medicine first, and if we have to, we can still shock, but we'll give him something to sedate him a little bit. So we started an IV, started the medication, contacted Huron Valley. Because of the immediate life threat, we still took him in with lights and siren, and he converted to a normal heart rate just as we moved him from our cot to the trauma bed. So, and he had a very good outcome. I have the best job in the world. I have a great partner. I work for a great company. I get to help people.
What I like most about what I do is not knowing what's going to happen from day to day. That kind of excitement and the adrenaline rush that you get when you head to a call, and then being able to take somebody's worst day and make it just a little bit better.
What I do, I like helping people and making them, getting the best I can for them.
I save lives and I help people on a daily basis.